Hi, my name is Charles Morris, Senior Marketing Manager with Agfa Healthcare, currently at the SIM 2011 conference where we are highlighting our Impax Data Center medical imaging repository. So today I'd like to speak to you about the Impax Data Center medical imaging repository and how to image enable your EMR. As you're very aware, medical imaging is exploding across health systems today. Traditional departments like radiology and cardiology, while they're generating lots and lots of images, are fairly flat in their growth. The departments that are elsewhere inside the enterprise, the growth is significant, and today's health systems want a mechanism in order to help their organization manage these images. So I'd like to speak a little bit about what is an EMR in healthcare today. Most organizations have a core clinical information system that helps manage multi-departmental workflow, results, orders, and things of that nature. Most organizations have a system by one of the core key clinical information systems vendors such as Epic, Cerner, GE, etc. These organizations also typically have a document management system, and this document management system is in place because it manages a different type of data than the core clinical information system is designed to manage, such as registration, consent, discharge forms, typically paper documents. Organizations also have imaging systems that are represented in individual departments. Most of these imaging systems are owned and managed by the department, but do not have an equivalent enterprise system that is on the level of the clinical information system or document management system for the enterprise. Each individual department may be creating images on its own. It does not necessarily have an enterprise system on the level of the clinical information system or document management system. So the electronic medical record is really, at this point, a combination of the clinical system and the document management system, and maybe they might have one of these individual departmental systems integrated into the EMR, if you will. But there is a large gaping hole in the strategy that there isn't an enterprise level system that helps manage multi-departmental imaging. This is where a medical imaging repository can help resolve the problem by providing an enterprise level platform that is on level with the clinical information system and document management system that provides a universal method to acquire, store, exchange, and provide visualization of medical imaging across the health system. So let's speak a little bit more about what constitutes a medical imaging repository. The medical imaging repository really consists of 4 core pillars or services that it needs to provide to the enterprise. So the medical imaging repository, or as some folks are calling it, the imaging EMR, really constitutes of 4 core pillars: capture, storage, exchange, and access. The primary function of the capture functionality is to provide multi-departmental turnkey imaging workflow. The medical imaging repository must be able to enable the enterprise to provide capturing of medical imaging data that has high quality demographics, high quality study identification, and also has the ability to provide services to the department that the systems in that department can integrate to. The storage pillar, or storage services that the medical image repository must provide, provides for multi-facility vendor-neutral archiving and must provide strong standards conformance, ILM and retention management. It is the portion of the medical image repository that provides for the long-term image store, the physical storage of the medical imaging data. The exchange pillar, it provides for services for the exchange of data between systems and other medical imaging institutions. And the medical imaging repository must provide services so that you can exchange data efficiently between dissimilar systems through things like medical record number localization, tag morphing, and providing general vendor neutrality. The access pillar is where the clinician actually gets the ability to utilize the medical imaging data in the day-to-day care of a patient. And so providing access to all the medical data that has come from any department across the health system must happen in a very efficient manner. And by providing medical imaging in a universal viewer that is tightly tied to the capture and storage components, the medical imaging repository can provide point of access to medical imaging anywhere that the physician needs access. And lastly, the access services should provide the viewing technology as a zero footprint, zero download viewer so that images can be accessed anywhere, anytime, on any operating system and with any modern browser. Agfa's Impax Data Center family of products are uniquely aligned to provide the services required by the medical imaging repositories for pillars. Agfa today is delivering these services to hospitals large and small. So with the medical imaging repository as a part of your core electronic medical record strategy, your health system can have fully embedded imagery directly within your clinical information system, unifying images and medical information. Thank you for your time. For more information, please visit agfahealthcare.com or contact your local Agfa representative.